Listening to ABC News.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hello, good morning. How are you? This is Gil Lederman. We're broadcasting live from the ABC studios in the heart of Manhattan, a few steps actually from our office. So hope you're all doing well and waking up, or if you've been up all night. I know a lot of people have been up all night. So I walked through streets of Manhattan to get here, and I saw girls coming from parties and people going to work. So I know that there's a lot going on even at 5 in the morning. My name's Dr. Gil Lederman. I work at Radiosurgery New York. It's at 1384 Broadway. It's the corner of 38th Street and Broadway in Manhattan. We're right between Macy's and Times Square. So I have a spacious, modern cancer treatment center. And the goal is to give you the best treatment, the best consultation to find the cause of your problem. You come in and get taken care of. So feel free to call us for that booklet DVD or questions. The best, obviously, is to make an appointment, and we sit down and spend some time with you and try to figure out what's going on. And, as you'll see from the program, we usually can figure out what's going on, and sometimes we find things that nobody else has. And that's the whole point of it. So I'm going to talk about the first man, a man with lung cancer, which is not an uncommon disease. He came in just yesterday, and Valentine's Day. 74 years old, married. He was born in Cuba. He has some other medical problems, diabetes, high blood pressure, cholesterol. Also has cancer. And he's been getting chemotherapy since October. So he had October, November, December, January, February. There's something called cancer markers like CEA. CEA is a cancer marker that's used in many, many cancers, and many cancers have markers. So you may ask, what the heck's a marker? I've never heard about a marker. My doctor's never told me about a marker. Well, I find that a lot of patients don't ever hear about the markers. Well, what's the benefit of knowing what the marker is? Well, let's say, for example, this man, he's been in chemo, October, November, every week, chemo. And I went back to look at the markers, and his markers are always going up. There's never been a remission. There's never been a period where the chemo doesn't cause nothing happening, kept the patient sick, and the cancer keeps on progressing. So then you can say, why the heck should I take chemo if the cancer's progressing? Why don't I know about the marker? Shouldn't I know about the marker? And the answer is yes. If you come to us, you'll know about the marker, you'll get a copy of the report in your hand, you'll know exactly what's going on. And I find it so strange that patients are people with another name, but they're really people just like you and I, should have the right to know what's going on with our body. You are the President of the United States of your body, and you get to decide what's going to happen to my body. Do I want this or do I want that? What are my options? Well, the more information you have, the better decision you can make. So if you see your cancer markers going up, and you're getting chemotherapy, then the logical conclusion is, hey, let's stop it. The treatment's not working, so-called treatment. If the so-called treatment's not working, then it's not really a treatment. And since chemo can be poisonous or toxic, it means you're getting sick without getting the benefit of the cancer shrinking. It's time for a change. And that's what we talk about. If you're not getting better, the pain's not getting better, if the pain's getting worse, if there's bleeding, if there's suffering, if you can't tolerate it anymore, it's time to think about another strategy. And that's the beauty of our program. Our program allows us to hit the cancer wherever it is, whether it's in the head, the body, the lung, the liver, the adrenal, the pancreas, the bone, the breast, the ovaries, the uterus. We can hit it without the systemic effects of chemotherapy and without surgery. We have a call on the line. We'll see if we can hear this call. So let's try it. Good morning. You're on radio. This is Dr. Lederman on WABC. Good morning. Good morning. Guess we got disconnected there. But if you have questions, call us at 1-800-848-9222. We're in the WABC studios. So what happened to this man, 74-year-old man with metastatic lung cancer? We staged him up because he was having more pain, back pain. We staged him up, and we found several things that his doctors who have been taking care of him for the last 5 months never knew. Number one, the cancer was in the bones. And when cancer is in the bones, it puts pressure on the bones and puts pressure on the nerves and gives pain. And radiosurgery is actually very effective to kill the cancer in the bones, usually allows the bones to heal up, and usually takes away that pain non-invasively with just a few treatments. Our usual treatments are about 15 minutes. So number one, we've probably found the cause of his pain. But guess what else we found? Any ideas? We found that both kidneys were blocked by a cancer in the bladder. So no one ever knew about it. No one even ever looked. We looked. We found a blockage, and we're going to get his kidneys saved. If the kidneys are blocked up, it means the urine can't go from the kidneys through the ureters to the bladder and out into the world. If the urine can't be eliminated, if the urine is backing up, the urine will destroy the kidneys. So for this man, he came in one fell swoop. We found where the cancer is. We found that the chemo was not working, that the cancer was growing in his lung, in his bones, and he had bilateral hydronephrosis. So luckily, we're able to take care of him, save the kidneys, which means, you know what that means, saving his kidneys, both kidneys. And number two, to treat him to eliminate or reduce the pain, suffering, and to treat the mass in the lung. Our success rate in treating lung cancer, either where it is in the lung or where it has spread, in this man he has stage 4 cancer because the cancer's got into the bloodstream and spread to the bones. We're able to treat that cancer where we see it, decrease the pain, decrease the mass most likely. We can't guarantee, but I can tell you that of thousands of patients we've treated, our success rate is about 90%. And that's for the rest of the life of the patients, not for 3 weeks or 6 weeks or something like that, how chemo is often measured, but it's for the rest of the life of the patient. So it's a very high success, easy treatments. We make a stereotactic frame, so it's custom made for the patient. We can focus the beam to hit the cancer. It's like Star Wars. If you remember, Star Wars was aimed to block out enemy satellites and rockets. Well, we can do the same technology, but block out the enemy cancer, which is the enemy. So it's great technology. We have a package and a DVD, which we'd be happy to send to you at no charge. Our number during the week is that 212 choices number, 212 choices. And by calling us, we will speak with you, answer your questions, and of course the best is to make a date to meet. Sit down, go over your case, Like in this gentleman, we can find out where the cancer is, the cause of the symptoms, and get him treated in a prompt way. And this was all done for this man in less than a day after he had waited 5 months elsewhere. So it gives you an idea of the kind of work we do. And, of course, we wish this man well. His kidneys are being really saved now, and then we'll be taking care of the cancer on Monday. So that's all planned out. All the work has been done. We work nights, we work weekends to do the treatment planning so that we can deliver the treatment to stop and shrink the cancer. We have a call, and I'm happy to take that call. Good morning.
Good morning.
Good morning. What's your name?
Clinton.
Hi, Clinton. How are you today?
Okay, thank you. I just got a PSA test. I'm 81.
Mm-hmm.
And,
you sound like you're a young 81.
Oh, I hope so. And the results came back at a 4.68, whereas my tests, which I get every year, were always in the 3s in the last several years. So I was wondering what the course of action should be. I haven't had a chance to see the urologist.
Well, are you in otherwise good health?
Yeah, well, I have heart disease, but that's pretty much under control.
It's under control. So you're 81. So the typical 81-year-old man's going to live another 15 years. So it means that generally you can consider other treatment, and there is other treatment out there. Now, you basically have several forks in the road, one decision to do. And again, you got the PSA for a reason. If there was no reason to get the PSA, then you shouldn't have got the PSA. So you have it. So presumably you got it because you wanted to know what it was, or your doctors wanted to know what it was. So, and they probably did it because they felt that you were in pretty good shape. So in general, the next step would be to do a biopsy of the prostate. So that's
with that 4.68 call for a biopsy?
Well, usually it does,
okay.
And especially because your PSA went from 3 to 4.6, that's a jump of about 50%. So there's several things that make people concerned. One is the absolute level of the PSA, but the other thing is the PSA velocity, how high, how fast it's rising. Now you can say, all right, maybe you don't trust that 4.68. You can repeat it and see if it's really true or not. Sometimes there's laboratory error that makes it seem higher or lower than it should be. So you can say, well, I don't really want a biopsy, so let me repeat the PSA, and maybe the next PSA is 3, and if the next PSA is 3, you can say, okay, maybe it's not so bad, and I'll wait a while. If you can repeat the PSA and it's 4.68 or 5 or something like that, then it's probably real. And again, for someone like you, who most likely is going to live another 10, 15 years, then you may want to do something about it.
What's free PSA?
There's different ways of evaluating the PSA, whether it's bound to protein or not. But the most reliable in general is the PSA that you had. And that PSA in you shows a 50% increase.
Yeah.
And
all right, so then I should get retested, and if it's still high, biopsy would be in order.
Yeah, that's what I would do. You sound like you're in great shape. There's people who are 81 in great shape. There's people who 41 in great shape, and people who are 41 not great shape. So it really depends on what your life expectancy is and what you want out of life. And treatment with us, for example, is really very easy. We're not talking about radical surgery. In fact, if you look at our booklet, which we'll send you if you call us during the week, you'll see that our results are markedly better than with radical prostatectomy and better quality of life if, God forbid, you have cancer. Hopefully you don't have anything. It's very likely at 4.68 that you have nothing. So it's not guaranteed you have cancer. Actually, it's most likely you have nothing.
But if I do, then you suggest your method.
Well, then we'll talk about different treatments. The whole point of our booklet is actually to compare our results to those of other centers that do proton beam, that do radical surgery, that do 9 weeks of treatment. And you'll see from the booklet, and we've included most every major center in America, from Boston to New York to California to Houston to Baltimore. They're all in our booklet, and I think we're the only ones that give actual data. And the reason we give the data for men is so that they can really sit at home and read it and understand that there are differences. And let's just say, God forbid, I'll open the booklet to give you an idea. Let's say, God forbid, you have a cancer, 4.68 PSA, okay? Mm-hmm. And you go